Good morning, everyone. I'm Dr. Max, and here's Herman, who is in his beginning of the journey of restoration or repair surgery after he unfortunately had a botched procedure which resulted in recipient zone necrosis. Today we're going to have our first restoration procedure. The idea is to try to induce some changes in the scar tissue, because scar tissue inherently is difficult to work with. Scar tissue is less vascularized, it means less blood flow, and in order for graft to survive, we need to provide as much oxygen as possible, right? So how was your preparation for the surgery? How's everything was going?
Good, actually. I think today is going to be my sixth hyperbaric treatment. Done some Folix and some PRP. I think that's helping. I think it's going to help me with, better recovery. And I feel more confident now with the preparation that I have had that I didn't have in the past. So
I'll review some images here. This is the area of the scar. You can actually see those little dots on the screen. This is what was left from the previous treatment with Folix. That's completely normal appearance. Right here, we can see this the donor area. We still have a good density. Here's another area of the temporal zone of the donor area. Same thing, some previous harvesting. We still have a good quantity of hair remaining. This is your occipital area right here. A good thing about the donor area, you have very coarse hair. The mission today would be harvesting as much as I can without visually depleting the area. So I'll use the big power microscope, a neurosurgical microscope, to be able to target those precisely, and at the same time watching overall how not to cause of further depletion of the donor area.
So explain to me, doctor, on these markings that you have here. So on the lateral side, how much grafts are you planning to harvest?
On the side, usually we have naturally lower density. The reason why I divide it into those small cells, so I can compare each one of them. And let's say, for example, spot right here, you have this spot was over harvested, so I won't be taking anything from that spot. While here we have higher density, for example, and I can be a little bit more aggressive. So my goal is to utilize the entire donor area. It will give me an opportunity not to over harvest any particular zone.